Times they are confusing. They are confusing at times. And if you score in that area above 60, 70, 80 marks out of, if you have solved correctly out of 100 or 150, then your practice is good. You have been relevant in terms of your peripheral reading material. You
Mm.
have good access to the right kind of a literature. And let us be very clear about what are the books we have been having. You can just write it down in our uh, chat box. What are the text you are reading, which is helping you out, so we can all benefit out of it. There are many texts and many books are available, and lot many people are doing lot many things in homeopathy. You see, people are very proactive now, and
Mm.
very proactive, and especially in the south, they are very hard worker, and they have a tradition of training their young doctors since long time back. Similarly, Odisha people, Calcutta people, they are also very competitive. And I do not know much about Maharashtra, how they are. If anybody has any idea, they can just share ki what is the kind of academic activity, especially from the UPSC point of view, how they are doing. Regionally speaking, in Rajasthan or in Himachal Pradesh or in, you can say, Punjab, UP, Delhi, and JK also coming up state for state level examinations. And Delhi is the hub where you have UPSC, the body which is taking judging people across the nation, across the nation. So most of the time we would like to be very much interested in the questions which have been there in the UPSC, especially Delhi based. So I hope we have the strength of approximately 13 participants we have. I'll go ahead with that. So friends,
तो स्टार्ट कर लेते हैं, हाँ, 10
we,
9-10 हो गए.
we will go ahead with the routine action activity, right? So friends, this was the sixth question in the Madhya Pradesh National Health Mission, which was conducted on 23rd June 2022. And this question was, we have dealt this question last time. So the epithelium forming the lining of kidney tubules, variable A, we call variable A, it is a distractor basically. They select the distractor to confuse you. So you have to understand what is the strength of the distractor at times. How confusing is that? And that demands clarification. Okay. Second distractor is glandular epithelium, and third is cuboidal epithelium, and D stands for columnar epithelium, and answer was C. And we could see the kidney, simple cuboidal epithelium lines the lumen of convoluted tubules. And here this was the histological feature. And here we could see the cuboidal epithelium lining the luminal indicated by IU. So this is what the histopathological finding under the microscope will help us to understand and remember this particular answer to this question. So let us go to the next. It was from physiology. The next question from Madhya Pradesh National Health Mission is from Madhya Pradesh physiology. Which of the following is due to the closure of semilunar valves and mark the onset of ventricular diastole? Variable A, first heart sound. Variable B, second heart sound. Variable C tells us both first and second heart sound. And D is the third and fourth heart sound. So answer was B, second heart sound. Now let us see. This is a particular phonogram, and the pressures in the big blood vessels, like in we have you can see here the pressure changes on this side shows the pressure changes, and this is in the aortic region where the pressure difference takes place and aortic closure takes place. Semilunar valves are present in atrio. It is in the pulmonary valve, and aortic valve is semilunar valve. Tricuspid and bicuspid valve are the atrioventricular valves. So let us see what happens. You see, the first heart sound is produced and it is known as lub. Ventricle contract and both atrioventricular valve close, and this closure at this point causes a vibration which is known as lub. This is the first heart sound. The second heart sound takes place because there is a semilunar valves. They close at the end of ventricular systole, and it is the place and timing and the pressure changes which are responsible for this particular semilunar valve closure. And with closure, there is a good vibration occurs because it closes with a force. So second heart sound, the dub is produced. So the aortic and pulmonary valve closure produce the second heart sound, and this makes the beginning of diastole. So this is what we can clearly understand. What is the significance of second heart sound and beginning of diastole? We can go to the physiology. Second question, it is eighth question. Failure of temperature regulatory mechanism of hypothalamus causes failure of temperature regulatory mechanism of hypothalamus causes. It means he is telling us that temperature regulator mechanism is present in the hypothalamus. So it causes heat stroke, it causes heat cramps, it causes heat syncope, or it causes heat exhaustion. So our answer here is heat stroke. Our answer here is heat stroke. So let us go for the general idea about the heat stroke occurs when the body becomes unable to control its temperature. And there is in the hypothalamus, we have temperature regulatory mechanism, thermosensory efferent and effector organs where these particular action is going to take place, how the sweating is going to take place, how the blood vessels are going to dilate, how the heart is going to function, how the muscles are going to function, how the thyroid is going to function. So many things are there which ultimately attribute toward the temperature regulation and raising the body temperature. But that fails and it causes in the hypothalamus. Thermoregulatory neurons, they are located in the preoptic hypothalamus and are responsible for thermoregulation. When the thermoregulation mechanism fails, the body temperature becomes abnormally high or hyperthermia occurs. And when the hyperthermia occurs, the temperature rises rapidly, sweating mechanism fails, and the body is unable to cool down. Body temperature may rise to 106 Fahrenheit or higher, 100 more than 17 or 108, and it is very short period of time within 10 to 15 minutes. So it is not necessary that you are exposed to summer sun in the summers, but sometimes there are people who are working in the furnace, there are people who have been working in the steam engines, there are people who are working in the big factory where they are dealing with the iron, they melt the iron. There were ships which used to have the big furnace where they used to produce energy, thermal. They used to bring up the vapors and the ships used to move. So those in those areas, those people who have been working, they are exposed to this kind of high temperature zone, and they used to suffer from this kind of a problem. So let us go to the physiology. Next question is 9. The taste sensation of the anterior two-third of the tongue is transmitted through the fibers of variable A is facial nerve, variable B is glossopharyngeal nerve, variable C is hypoglossal nerve, and variable D is vagus nerve. What is the answer? Anybody can try. The taste sensation from anterior two-third of the tongue is transmitted through the fibers of facial nerve, glossopharyngeal nerve, hypoglossal nerve, and vagus nerve. We have four variables. Anybody? Uh, B. Glossopharyngeal nerve. Okay, Tanya.
Facial
Glossopharyngeal.
nerve. Facial.
Nerve. Okay, facial nerve. Now, the facial nerve is important, Tanya. Please remember, let us go to the diagram. We have the taste sensation for anterior two-third of the tongue is carried by chorda tympani. Chorda tympani is a branch of the facial nerve. Okay? Chorda tympani is a branch of facial nerve. If you have the book, you can take it out and see facial nerve. So facial nerve, when it comes, facial nerve is a seventh cranial nerve. It is predominantly motor. It is going to supply to the muscles of expression. The facial muscles, which are muscles of expression, they are going to be supplied by facial nerve. Facial nerve, when it comes down, so there is a bend and there is a swelling that is most probably known as a genu, and at the genu one particular nerve comes out. It is known as geniculate ganglion mostly. Genu is the bend and geniculate ganglion is there. It is a geniculate ganglion. Whenever the nerve which has got ganglion, you have to understand that it contains the sensory component. It contains the sensory component. So this particular nerve which comes from here, that is a chorda tympani nerve, and that chorda tympani nerve crosses the middle ear. It goes through the middle ear from posterior to anterior, and it is just behind the upper part of the tympanic membrane. Upper part of the tympanic membrane is pars flaccida, and lower part of the tympanic membrane is pars tensa. Sometimes children who have otitis media, and if there is a rupture through pars flaccida, probably this nerve, chorda tympani nerve, is going to get affected. And if it is going to get affected, what will happen? It unites with this chorda tympani nerve is going to supply to the tongue. But how it is going to supply to the tongue? It unites with the mandibular division of lingual. We have trigeminal nerve. Fifth cranial nerve is trigeminal, ophthalmic division, maxillary division, mandibular division. So mandibular division has got a branch which unites with the lingual nerve. It is known as lingual nerve. Branch of mandibular nerve is lingual nerve, which supplies general sensation to the anterior two-third of the tongue. It supplies general sensation to the anterior two-third of the tongue. And same time, because it carries the fibers of chorda tympani, it also supplies anterior two-third tongue for spatial taste sensation. So here you will see in this particular diagram, this is the V shape, this is the vellet papillae, this is the vellet papillae, and there is a foramina cecum here. The small foramina remains here, and there a V-shaped line goes like this. So these are the four on each side. Vellet papillae are present. In front of vellet papillae, we have the tongue, and it is the anterior tooth of the tongue, which is supplied by chorda tympani, which is a branch of seventh cranial nerve for spatial sensation, means taste sensation, and lingual nerve, which is a branch of the V3. It is mandibular division of fifth cranial nerve. This is V3 means V stands for the fifth cranial nerve, and third branch of fifth cranial nerve is mandibular division, and mandibular division has a lingual nerve branch which goes to the tongue and supplies for general sensation. You got it? So answer A, facial nerve is correct. Please remember other variables, glossopharyngeal nerve. Here we have glossopharyngeal nerve, which is the ninth cranial nerve, and see the color code where it is going to supply. Posterior, one third is supplied by glossopharyngeal nerve. For general
अभी म्यूट लिखता हूँ.
sensation and then you will find epiglottis. This part is epiglottis. Dheeraj, nice. Good to see you. So this epiglottis part, this particular part is supplied by 10th cranial nerve, branches of the 10th vagus nerve, which may be there are two kind of sensory branches vagus carries. One, it carries for palatoglossus muscle, and second, it carries for general sensation, spatial sensation also, and general sensation also. So it has got the 10th cranial nerve, which is vagus, is basically a parasympathetic nerve. It is a parasympathetic nerve, but how it can carry the motor fibers? Because when it comes out of jugular foramina, in jugular glossopharyngeal nerve, we have vagus nerve and we have one more nerve. Can anybody name? Accessory nerve, 11th cranial nerve, accessory. So accessory nerve has got two components, cranial accessory and a spinal accessory. The cranial accessory part gets attached to the vagus nerve and supplies here. Okay. So this is the trick which happens here in terms of motor nerve. All intrinsic and extrinsic muscles are supplied by hypoglossal nerve. 12th cranial nerve supplies the tongue for all external and extrinsic and intrinsic muscles. So, but there is an exception to the rule. Palatoglossus is supplied by 10th cranial nerve through pharyngeal plexus. What we call it, pharyngeal plexus. We don't call it vagus nerve. We call through pharyngeal plexus. Now, the sensory anterior two-third general sensation is by lingual nerve, which is the fifth cranial nerve, trigeminal. Its branch is mandibular, and mandibular division's branch is lingual nerve. Taste sensation comes from the cauda tympani branch of the facial, which is the seventh cranial nerve. And we remember this nerve as a purely motor nerve. No, it is a mixed nerve. Okay. Posterior one third general sensation and taste sensation is by glossopharyngeal, which is the ninth cranial nerve, and the root of the tongue, most posterior part, is by internal laryngeal branches of the vagus. And it is the 10th cranial nerve, but then it is going to carry the fibers from pharyngeal plexus. So that is the way. So let us go to the physiology. 10th question. Which part of the brain is important for understanding speech and language? Can interpret the speech and language. We have variables, vernix area, second Broca's area, third prefrontal area, fourth is audito-psychic area. Anybody can try to answer. Okay, Broca's area, Tanya, Broca's area, yes, Broca's area. Thank you, Tanya. I find you both are correct, but we find it is vernix area. And let us go to the recall. In recall, what we see, this is the diagram of the lateral surface. On which side? This is showing you the right side or left side? Supralateral surface, right side or left side? It is showing supralateral surface, right or left side? Anybody? Anybody? Left side. Why? Because it is the dominant cerebral hemisphere. Why? Because it is dominant cerebral hemisphere and area, speech area is present in the dominant cerebral hemisphere. So that's why we are showing you the dominant cerebral hemisphere, and same area where the speech area is present, and the same place you have the vernix area is also present. Please remember, in the dominant left cerebral hemisphere, provided the person is right-handed. But if you are a left-handed person, it will be on the opposite side. So here we can see the vernix is located in the posterior third of the upper temporal convolution of the left hemisphere of the brain. And this is the thing, vernix area, you can identify it. And now the function is, it is associated with the understanding of open spoken and written language. Spoken and written language. Applied, lesion of this place causes disorder of sensory speech. People cannot understand. People cannot understand. Anybody remembers in what disease it happens? There are many diseases where it can happen, but very important, a disease where it is associated with some vitamin, some vitamin. Which vitamin is that? Uh, There are two vitamins which are very, very important in the central nervous system. And generally, because of alcoholism, people do have previously during the era of 1950s, 60s, and 40s, they were having the problem. So it was vitamin B12, vitamin B12 and B1. B1 causes beriberi, dry beriberi, wet beriberi. And vitamin B12 used to cause deficiency and vernix encephalopathy and vernix whatever it is, disorder of sensory speech. Broca's motor area is area number 44, 45, and this is present in the uppercular triangular section of the inferior frontal gyrus of the frontal lobe of the dominant cerebral hemisphere on the left side. And function is, its role is in the production of speech. If anything goes wrong here, you will not be able to speak. And then prefrontal area is located in the cortical region of the anterior part of the frontal lobe, and it is associated with planning and goal direction, goal directed behavior. It is a seat of your personality, seat of your intellect, seat of your understanding. So auditopsychic area is present in the superior temporal gyrus, and it is known as area number 22. So this is a Brodmann's area number. We can see what are the primary auditory area 41, 42, auditopsychic area 22, and in this way area number 45 and 44 we have Broca's area. So this diagram is a mapping of the brain surfaces with the Brodmann's area number. Okay, auditopsychic area. Now, next we go to the organon. Now we have the question from the organon. This is question number 11. The disease having few symptoms is known as one-sided disease, local disease, partial disease, local malady. Anybody can try. Okay, one-sided disease.
One-sided disease, sir.
Okay, nice. So we'll see. The aphorism number is 173. Diseases that seem to have but few symptoms and on that account be less amenable to care are those which may be termed as one-sided. So this is the aphorism which we have to see and refer in this particular question. We have second question from the organon. Full-time amelioration with no special relief to the patient indicates palliation, suppression, cure, aggravation. We have four variable: palliation, suppression, cure, and aggravation. Anybody can try. Full time
Palliation.
palliation. Okay, all right. Let us go by palliation. And the palliation, full time amelioration with no special relief of patient, points to seventh observation of the Kent's 12 observation and indicates palliative relief to the patient. So what does it mean, palliative relief to the patient? Above situation suggests that the condition is either latent or latent existing organic pathology. Whenever the pathology is functional, whenever the tissue damage is not there, organ damage is not there, most of the time the disease is reversible. You are lucky. Cure is only possible if you have in that window period, the patient is in that window period where the pathology is functional or reversible. Once it is pathology is advanced and there is a tissue destruction or tissue transformation takes place, like there can be tumor, there can be cancer, there can be many things, recovery will not be possible. So you may find with your medicine, there can be some relief to the patient, but cure will not be possible. So here, the organic pathology is causing obstruction to recovery, and it is amenable only to certain degree. However, the irreversible pathology is acting as an obstruction to recovery, as what we know. The prognosis is outcome appears to be poor. Treatment is palliative as it can ameliorate to some extent. We go to the next question, Argnan. Title of the book written by Stuart Close on homeopathic philosophy. It is lecture on homeopathic philosophy, the genius of homeopathy, the art of cure in homeopathy, science of therapeutics and homeopathy. Okay, okay. Yes, it is B, genius of homeopathy. Let us go to the answer. Yes, it is B. And let us see the genius of homeopathy is it. It comprises a series of lectures delivered at the New York Homeopathic Medical College by Stuart Close. And this is the title page of that particular book. You can see the Stuart Close and you can see the name of the book. The Stuart Close explains the principles and philosophy of the homeopathic system of medicine. This book is one of the most clear and lucid compilation of philosophical basis of homeopathic study. It thoroughly explains the concept of life, health, and disease. So let us go to the next question. We have Organon, question number 14. The sixth edition of Organon of Medicine, Dr. Samuel Hahnemann has given an idea about primary and secondary action. In which of the following aphorism? In sixth edition of Organon, idea about primary and secondary action is given in which aphorism? Aphorism 26, aphorism 61 to 62, aphorism 63 and 69, 60 through to 69, and aphorism 70. So this is the theoretical part in Organon, and practical part is from 71 onwards. So this is the answer is C. Okay. Okay. Anybody can try. Okay. Let us try now. This is C. Answer is C. And we can go for recall. So aphorism 26, it tells us about the homeopathic law of cure. Homeopathic law of cure. And homeopathic law of cure in brief defines the weaker dynamic affection is extinguished by a stronger if it is similar in nature. Weaker dynamic affection is extinguished by the stronger one if it is similar in nature. This small line is coming from the Julian. Julian has written a condensed form of aphorisms of the sixth edition of Organon. Now we go to the aphorisms 61 and 62, and both collectively deal with disadvantages of antipathy and advantages of homeopathy. These two aphorisms are distinctly related to advantages of antipathic treatment and advantages of homeopathy. So section 61 tells us that physician, if they had been capable of reflecting upon the sad results, should see that result of applying contrary medicines and understand that the homeopathic way is better and only way to cure. And 62 in brief is the reason palliation is dangerous is explained in paragraph 63 and 69. 62 is a brief, but expansion is in 63 to 69. Aphorism 63 to 69 tells us the reasons palliation is dangerous. Reasons palliation is dangerous. So let us go to the aphorism 63 to 69. 63 tells us that primary action of the medicine and the secondary action of the vital force or counteraction. 64 is explanation of primary and secondary actions. 65 is explanation of the primary and secondary effects as stated in paragraph 64. And 66 in brief tells us in healthy body, one does not notice the secondary reaction due to the homeopathic doses, but the primary action of the sum of these remedies is replicable, perceptible in a good observer. And 67 tells the truth explained why homeopathy is good, and there are many things like mongrel sect and other things which they have discussed here. And 68 is homeopathic experience shows that a small dose of medicine will extinguish the natural disease. So C is the answer because it deals with primary and secondary action in detail. And 69 is exactly the opposite happens in antibiotic treatment. The disease becomes worse when it is the palliation wears off. We go to the aphorism 70. Aphorism 70 is a summary of whatever in the theory part the Dr. Newman has been telling. It tells us about the life, the vital force, endows the body with sensation, function, and power of self-preservation. In health, a state of ease and comfort, harmony in sensation and function. In disease, primarily derangement of the vital force, expressed by the perceptible sign and symptoms. Totality of perceptible symptoms constitute the disease, and the medicine, their curative power lies in the power of they possess in altering the healthy state and cure changes to the healthy state of the disease individual. So these are the things which we see here. Next, again, it goes to the organon. And in organon, this is the question number 15, the organon of medicine, sixth edition. Aphorism 79 dealing with A, false chronic disease, B, true chronic disease, C, knowledge of syphilis and psychosis, and D is a fundamental cause, Sora. So anybody can just give me the hint so we can go ahead. C, knowledge of syphilis and psychosis. Okay, all right. Thank you so much. It is correct choice. And we see that the knowledge of syphilis and psychosis is given. Hitherto, syphilis alone has been to some extent known as the chronic miasmatic disease. Psychosis, the condylomated disease, equally ineradicable by the vital force without proper medicinal treatment, was not recognized as a chronic miasmatic disease of a peculiar character, and many other things which he is talking here. But ultimately, it deals with the knowledge of psychosis and syphilis. We go to the next question. Next question is 16. Aphorism 99 of the sixth edition of Organon of Medicine. Dr. Samuel Hahnemann has given an idea about patient coming directly to the physician, patient coming from another physician, special direction in chronic cases, and special direction in acute cases. Anybody? Anybody? We have four variables, and the question number 16, aphorism 99, deals with A, B, C, D. Patient coming directly to the physician, patient coming, okay, D, special direction to acute disease. Okay, all right, nice. Looks like it is the correct answer. D is the correct choice. 99, recording the acute case is easy. On the whole, investigation of the acute disease is much the easier for the physician because all the phenomena and deviations from the healthy state that have been put recently or lost recently still fresh in the memory of the patient and in his friends still continue to be novel and striking. The physician certainly requires to know everything in such cases also, but he has much less to inquire into. They are for the most part spontaneously detailed to him. Arnon, we have question number 17. Who introduced humoral concept or doctrine of humors? Doctrine of humors. Variable A, Aristotle. Variable B, Plato. Variable C is Hippocrates and variable D is Socrates. Anyone can try. Just give me the hint. C is Hippocrates. Okay, all right. This is Hippocrates. Hippocrates is traditionally referred to as the father of medicine. He was in the era of 460 to 370 BC. According to Hippocrates, health was a function of the proper balance of four humors: blood, black bile, yellow bile, and phlegm. So he has proposed the theory of humors, and humor determines the person's temperament, and imbalance leads to certain sicknesses depending upon which humors were excess or deficit. He separated the discipline of medicine from religion, believing and arguing that disease was not a punishment inflicted by the gods, but rather the product of environmental factors, diet, and living habits. So that was something very strange in those eras. In those days, he was a very straight thinking person. So, friends, let us go to the Argon's 18th question. The word psychosis comes from the word fig. Psychosis comes from the word fig, which is an Greek word, German word, Roman word, or Italian word. Greek, German, Roman, Italian. Greek word. So the psychosis comes from the Greek psycho, meaning fig, a term used in Hahnemann's time to qualify benign genitoanal granulation tumors, whether accompanied by the purulent urethral discharge or not. Rest is okay. So let us go to the question number 19. Slow, insidious onset, course indefinite, has only prodromal and progressive period, defines A. Acute disease, B. Chronic disease, C. Both acute disease and chronic disease, and D is a pseudo-chronic disease. So acute disease, chronic disease, both acute disease and chronic disease, or pseudo-chronic disease. So what could be the choice here? What could be the choice? Okay, chronic disease is the choice. And here it is aphorism 72, chronic disease. And you can say the disease to which man liable to either rapid morbid processes of the abnormally drained vital force which have in tendency to finish their course more or less quickly but always in a moderate time. They are acute diseases, and apart from the acute diseases, what features are given here, they belong to the chronic disease, and the reference aphorism 72 comes from Organon. So we have question number 20. The action of medicine upon provers is ninth observation, 10th observation, 11th observation, and 12th observation. Which Kant's observation it belongs to? The action of medicine upon provers. B. 10th observation. It is ninth observation and ninth action of medicine upon prover. It is action of the medicine upon provers points to Kant's ninth observation. The proving always benefits the healthy prover If it is conducted in proper manner, action, the proving master should observe carefully the constitutional state of the prover. It is further nice to know is aphorism number 105 to 145 deals with the drug proving in organon of medicine. So, friends, we finish with this first 20 questions. So, we can go to next group 21 onwards questions. And from 21 onward questions, we have questions from pathology and materia medica. So here we have pathology 21. Which of the most commonly defectively produced antibody in multiple myeloma? Which is the antibody which is produced in multiple myeloma? IgA, IgM, IgG, IgD. So this is the answer is CIgG. The most common type of heavy chain produced in myeloma is IgG followed by IgA and IgD. Pathology again 22nd question. What is the storage form of iron? What is the storage form of iron? A. Ferritin, B. Transferrin, C. Ferroprotein, and D is heparidin. Ferritin, transferrin, ferroprotein, heparidin. So, okay, ferroprotein. Okay, A is ferritin. Okay, let us go to the answer. A. Ferritin. Storage iron is defined as tissue iron which is available for hemoglobin synthesis when the need arises. And the iron is stored intracellularly in protein complex as ferritin and hemosiderin. It would appear that whenever the cell is functionally intact, such iron is available for general body needs. We go to the question number 23rd. Lacunar cells, variant of Reed-Sternberg cells, are found in which type of Hodgkin's lymphoma? Lacunar cells, this is a variant of Reed-Sternberg cells, are found in which type of Hodgkin's lymphoma? So variable A, nodular sclerosis, lymphocyte depleted, lymphocyte predominate, and mixed cellularity. These are the four variables we have for Hodgkin's lymphoma, and the answer is A, nodular sclerosis. Nodular sclerosis subtype of classic Hodgkin's lymphoma. Here, this is the histopathological slides, and here we see lacunar cells are the predominant variant of lead Sternberg cells in nodular sclerosis subtype of the classical Hodgkin's lymphoma. Classic binucleated Reed Sternberg cells are the rare and are rare or absent in this variety. In formalin fixed tissue, these cells appear retracted or shrunken. Please see this particular slide carefully. And this is a formalin fixed tissue. These cells appear retracted or shrunken and contained in a lacuna. The cytoplasm is condensed in the perinuclear region, leaving an empty space, lacuna around it. You will find these are the areas, lot of empty spaces present in the cell. So this is the answer to the question. The pathology. Hemophilia A is characterized by deficiency of. Hemophilia A is characterized by the deficiency of factor 6, 7, 8, factor 8 and factor 7 or factor 9 or factor 11. So hemophilia A is characterized by, we have 4 milligram, factor 8, 7, 9 and 11. Okay, let us go to the answer A. And this is a X-linked recessive carrier mother. Here, this is Mother is carrier and you see the male and female, unaffected, male and female. And here, this is mother is carrier, and this is affected son. So, unaffected father, if they have four kids, out of these four kids, one will be unaffected daughter, unaffected son, and carrier daughter will be there, and then affected son will be there. So, this is how the hereditary linkage we find, and we see that hemophilia A is due to the deficiency of factor 8. It is an essential blood clotting protein known as anti-hemophilic factor. It is hereditary bleeding disorder caused by inherited X-linked recessive trait, the defective gene located on the X chromosome. Females are carriers and males are going to suffer from hepatitis A. Now, the pathology, we have 25th question. Severe bleeding occurs when the platelet falls below. When the platelet falls below, the severe bleeding can occur. We have the number of platelets 1.5 lakhs per cubic millimeter, 1 lakh per cubic millimeter, 50,000 cubic millimeter, and 20,000 cubic millimeter. What could be the choice for us when the bleeding, severe bleeding can take place? What is the cutoff point for that? The cutoff point is D 20,000. The platelet count in relation to bleeding risk. Let us examine the platelet count in relation to bleeding risk. Number one, platelet count and complications. If platelet is less than 60,000, risk after trauma. Bleeding risk is after trauma. If it is less than 50,000, surgical bleeding may occur. If it is less than 40,000, self-limiting bleeding. Bleeding will take place, but somehow it will be automatically, naturally will be stopped. And if it is less than 10,000, spontaneous bleeding may occur in idiopathic thrombocytopenic patients. So less than 10 to 20,000 is the very great danger zone where severe bleeding can occur. Less than 12,000 is spontaneous bleeding requiring a special attention. Special attention means transfusion 6,000, less than 6,000. If the platelets is less than 6,000, probably there will be life-threatening bleeding will be there. The risk of serious bleeding doesn't occur until the count becomes very low, less than 10,000 or 20,000 platelets per microliter. A platelet count of less than 1,50,000 platelets per microliter is lower than normal and known as thrombocytopenia. Platelets less than 150 lakh is known as thrombocytopenia. I had a friend, he had got similar picture. And we thought, what is going wrong? I could not understand. But he was examined at the hematology, and they found probably he was taking ecosprin. Pathology. 26th question. Exclamation mark here are pathognomic sign of. Exclamation mark here are pathognomic of alopecia areata, hypertrichosis, androgenic alopecia, and leukotrichia. Leukotrichia. The answer is A. We have, this is the exclamation mark here. This prime diagnostic feature of acute alopecia areata is the presence of exclamation mark hairs. These characteristic hair fracture at their distal end and taper proximally toward the scalp, giving them the appearance of exclamation mark. 27th question is tropical pulmonary eosinophilia is caused by. Tropical pulmonary eosinophilia is caused by A. Salmonella typhi, B. Plasmodium falciparum, Vaucheria bancrofti, And fourth option is Coxella burnetii. Coxella burnetii. So we have the answer C. This is the life cycle of Vaucheria bancrofti. Vaucheria bancrofti is a generally in India you will find in the Bengal, Bihar, and it is the transmission is by Culex mosquito. Syndrome with coughing, asthmatic pulmonary symptoms, high level of blood eosinophilia, lymph node swelling, and high concentration of serum antibodies, including IgE to filaria antigen. Serum antibodies to filaria antigen. Now, microfilaria are detectable in the blood, but sometimes in the lymph nodes and lungs. This is an allergic reaction to filaria antigens. So the answer is C. Vaucheria bancrofti. We go to the question number 28. Respiratory acidosis is the result from retention of bicarbonates, excessive elimination of bicarbonates, retention of carbon dioxide, and excessive elimination of carbon dioxide. The answer is C. Retention of carbon dioxide and respiratory acidosis. This is a particular diagram which shows hyperventilation, hypoxia, rapid breathing, low blood pressure, skin mucosa pale, and they may become cyanotic. Headache can be there, hyperkalemia can be there, dysrhythmia because of potassium elevation. We have drowsiness, dizziness, disorientation, muscle weakness, hyperreflexia, and the causes are respiratory depression because of maybe anesthetic overdose, or and then we have airway obstruction, alveolar capillary diffusion like pneumonia, COPD, acute respiratory distress syndrome, and we have respiratory acidosis is a condition that occurs when the lungs cannot remove all the carbon dioxide the body produces. This causes body fluid, especially blood, to become too acidic. Now we go to the question number 29. Which of the following is the first enzyme that appears after myocardial infarction? Which of the following is the first enzyme that appears after myocardial infarction? The variable is LDH, B CK, C SGOT, and D is SGPT. The answer is B CK. So creatinine kinase has subunits. Number one, CK1, CKBB, CK2 is CKMB, and CK3 is CKMM. CK enzyme activity is increased in skeletal muscles, cardiovascular system, brain, and thyroid diseases. CK enzyme is increased in muscular atrophy, especially Dutchman size. In progressive muscular dystrophy also, the enzyme levels are high in children between 7 to 10 years. It falls in older patients. CKMB is raised after myocardial infarction. CKMB is raised after myocardial infarction, and this is the time period how it will rise and how it will fall, it will come to normal. So soon after MI, it starts rising, and peak level is reached within 12 to 24 hours, and it comes to normal on the 48th hour. So first 12 to 14 hours, 24 hours are the time frame where you should go for this enzyme. And if you find this is high, it indicates myocardial infarction. We go to the question number 30. Bell's palsy. Bell's palsy, a lesion of lateral motor neuron type, upper motor neuron type, lower motor neuron type, and central motor neuron type. The answer is C. Bell's palsy is lower motor neuron lesion of the whole facial muscle, and there is the typical motor neuron paralysis. The upper part of the face is also involved, and lower part of the face is also involved. But in cases of motor neuron lesion, you will find only lower part of the face is involved. Upper part is spared because it has got contralateral supply. It's supplied by not only from the same side but from the opposite side also. We go to the materia medica questions. We go to materia medica question. कितना टाइम रहता है अभी हमारे पास में? How much time is left now? Any idea?
सर वी कैन गो सर टाइम तो कितना भी ले सकते हैं सर.
Okay, all right. So, materia medica में 31st question है, which of the following remedy is presented with the symptom cough ameliorated by lying on the stomach, and we have variables China, Cinna, Medorinum, acetic acid, Arsenicum album, and we have the answer B, where let us go for recall. Medorinum, asthma, cough, dry, incessant, severe, and here you will find like coughing in a barrel at night from sweat on lying down, better by lying on stomach. And this reference comes from Allen's keynote. Question number 32. Which of the following remedy is presented with the symptoms backache relieved by lying on the back? One is Ruta, Zincum metallicum, Agaricum muscaris, Rustox, and the answer is A. Let us go to the reference. Okay, it is Allen's keynote, and this is the Allen's keynote, and you will find where it is found at the last text. In the text, last line is the landmark for this particular line. So sometimes when we read the book, we so get exhausted that we do not remember these lines. So the people who ask question or they make the question, they generally pick up such certain areas which are there, but then they are not registered in your mind. We go to the materia medica. Which of the following remedy is presented with the symptoms to take from tea drinking? And variable is pulsatilla, coffea, mesoreum, thuja occidentalis. And answer is D, thuja occidentalis. So let us go. Thuja occidentalis, mouth, teeth decayed at the root. Anyway, but our answer is to take from tea drinking. It is coming from the Allen's keynote. Okay. And Allen's keynote, this is the text. In the middle of the text, this particular line we find in Allen's keynote. Given below two statements. Number one, causticum blisters appear resembling burns, pemphigus. And statement two is the phosphorus blisters form clusters about the joint. Choose the most appropriate answer from the options given below. A. Both statement 1 and 2 are correct. B. Both statement 1 and 2 are incorrect. C. Statement 1 is correct but statement 2 is incorrect. And D is statement 1 is incorrect but statement 2 is correct. So here the choice we have is the answer B. Both statement 1 and 2 are incorrect. Causticum, we don't have such symptoms. And this reference is coming from the boric materia medica. And for phosphorus also, this symptom is taken up from boric materia medica. We don't find both the variables to be present over there. Now we go to the question number 35. Remedy for after effects of vaccination. Remedy for after effects of vaccination. Salicylic acid, sepia, cinna, Thusa occidentalis. And answer is D, Thusa occidentalis. Let us go for recall. Elements from bad effects of vaccination. We have similar remedy, antimonium tart and silicea. From suppressed or maltreated gonorrhea, we have medurinum. And let us see the Thusa occidentalis in the Allen's keynote. And we find this symptom is positioned where it is to be seen in the text. We go to question number 36. Which of the following remedy is presented with the symptom singles? Vesicles may have a bluish appearance. Herpes zoster having bluish appearance, Tarantula hispania, Ranunculus bulbosus, Leukosis, and Ledum pall. Answer is B, Ranunculus bulbosus. And the reference comes from Allen's keynote. Vesicles may have bluish appearance. Okay. And text is given singles. Almost the last line we have here in the ranunculus bulbosus, Allen's keynote. We go to question number 37. The drug phosphorus is incompatible with A. Calcarea carbonica, B. causticum, C. Cinna occidentalis, D is phosphoric acid, and the answer is B. Causticum. Let us see from where the information comes. We are looking at the phosphorus incompatible with causticum must not be used before or after. Information is coming from Allen's keynote. And let us see the text. We find relationship incompatible with causticum must not be used before or after phosphorus. Remove the bad effect of iodine and excessive use of table salt. Anyway, so this is the text in brief what we'll see. We'll go to Materia Medica 38. Considering the Ranunculaceae family remedies, Atia spicata and Staphylococcus have an aggravation to which among the following? Having the aggravation to which among the following? Ranunculus family has got two drugs, Actia spicata, Staphylococcus. They are worse by warm, extreme cold, gentle motion, and open air. So here, physical feature answer is B. Answer is B, extreme cold. Ranunculus group medicine in homeopathy, physical feature, thermal reaction, most of them are chilly, according to Gibson Miller. Okay. And there is a sodic remedies are aconite, Actia racemosa, Helleborus, Sora and Psychosis, Pulsatilla, Ranunculus bulbosus, and Staphylococcus aureus. Sora, syphilis, and psychosis, hydrastis covers all three miasms. Okay. Now again we go to the 39th question. Which of the following remedy is presented with the symptom? Thinks she is pregnant and will soon deliver. So this is a kind of a hallucination. Zincum metallicum, veratrum album. We have valeriana and then we have Sambucus nigra. The answer is B. Veratrum album. We go to the thing she is pregnant and will soon be delivered. Allen's keynote is the choice of book which we are preferring, and this is the text where we are going to see that particular symptom. We go to the 40th questions. Which of the following remedy is presented with the symptom plica polonica? Several bad cases permanently cured after borax and sorinum failed. The variable is sulfur, B. tuberculinum, C. Mesoneum, and D. Zincum metallicum. And the answer is B. Tuberculinum. Let us see the text. Tuberculinum. And in tuberculinum, plica polonica, several bad cases permanently cured after borax and sorinum failed. Text is coming from Allen's keynote, and this is the text for tuberculinum, mesoneum, plica polonica, several bad cases permanently cured. Please remember, whenever we talk about tuberculinum and bacillinum, here both the drugs are given the same status. Allen has not given any differentiation to these two drugs. Okay, so sometimes people most often they say tuberculinum has got few things which distinctly different from bacillinum, but at the core of the remedy, both are having the same features. There is nothing, uh, people have differentiated, of course, about it. But at one particular given time, I had a discussion with Dr. हमारे दीवान हरिश्चंद्र से। वो कहने लगे कि भाई आप डिस्टिंक्शन तो बता रहे हैं लेकिन ऐसा है नहीं, आप जरा थोड़ा ख्याल से पढ़ें। और ख्याल से पढ़ने के लिए फिर मुझे अल्टीमेटली एलन्स की नोट से ज्यादा कोई अच्छी चीज समझ में आती नहीं थी। एंड आई फाउंड दे ही हैज डेल्ट दिस पर्टिकुलर ड्रग एट वन पर्टिकुलर पॉइंट ओनली। So I think friends, we'll finish here today. 10 बज रहे हैं, तो we'll call off a day, and thank you everyone for your participation and keen interest. We'll keep on revising ourselves with the question papers, and if at all you have anything else in mind, we can do that also.